So Healthcare Improvement Scotland has a crucial role for our patients and families and our staff in NHS Scotland. It does two principal things. It does scrutiny inspection, but it also does improvement, two sides of the one coin, not separate things. And older people is the perfect example of where these two parts of Healthcare Improvement Scotland's work comes together. We have a robust scrutiny and inspection model for older people's care, but we also have an improvement programme, particularly focused initially on acute care for older people. Many of the safety programmes and the person-centred care programmes inside Healthcare Improvement affect older people and improve their care. But there are specifics around older people's care that need some special attention. Areas like delirium, like frailty. So when somebody arrives at a hospital who's elderly, who may be frail, we know quickly, they're assessed quickly, they're in the right place quickly, and they get the right care. So every healthcare system in the world has priorities, it has to. So some of them are very sudden and daily, some of them are longer term. And you have to choose sometimes what you're going to concentrate on. And older people is a really important part of our work in Healthcare Improvement Scotland and in the Scottish Government. We have an increasing number of elderly people in our society. In the next 20 years there's going to be a 50% increase in the number of people over 60. So we have to do something special for that group. That group deserve and need person-centred, safe and effective care. And why wouldn't you have something that addresses those issues for that particular population? It will be different if you're 60 and if you're 85, but you still deserve the best healthcare system we can possibly provide. And Healthcare Improvement Scotland's work, both in scrutinising the care given to that group and in improving the care that's given to that group, is really, really important for us. So there are lots of different elements in a programme as big and as ambitious as the Older People's Improvement Programme, but there are a couple of neat examples that might help people understand what it's doing. There's a delirium bundle. Bundles are in many of the improvement programmes around the world, and they're sets of activities and tasks that you do with a patient and family and a carer that have to happen every time, every day, every time they're necessary. And the delirium bundle is one such example. It's been globally recognised and people are coming to see how it works. It's about early recognition and early care of that particularly difficult and challenging area in older people's care. The other element that's gaining traction is the frailty assessment when people arrive in acute hospitals. So that's quite a difficult thing to do, and early recognition of that frailty is really important because it will matter down the line what that care looks like. Overarching all of that, and inside that improvement programme, is the person-centred care elements. Families are worried about their relatives. They're worried about their relatives, particularly when they come to scary hospitals. So spending time with the patient and the family, spending time talking about not just the illness, what the person comes with, but also the needs of that family and the patient, is really important. And the Older People's Improvement Programme has allowed us to do that together.